Hey, welcome. Today we're diving into a medication called Edoxaban, which you might also know by its brand name, Savayasa. We're going to break down what it is, exactly how it works inside your body, and most importantly, the key things you need to be aware of, all based on the latest clinical data. So let's get right into it.
Okay, think about this for a second. Your body has this amazing built-in defense system to stop you from bleeding, right? It forms a clot. It's brilliant and it saves lives. But what happens when that very system goes rogue? When it starts building clots where it shouldn't, when there's no injury to fix?
Well, for people with certain conditions, like an irregular heartbeat called AFib, or a clot deep in a vein known as DVT, that defense system suddenly becomes a huge threat. A rogue clot can break off, travel to the brain, and cause a devastating stroke, or it can go to the lungs and cause a pulmonary embolism. The stakes here are incredibly high, and that is the exact problem that anticoagulants, or blood thinners, are designed to solve.
So, how do you fight back against these dangerous, unwanted clots? Well, let's meet one of the newer players on the scene, Edoxaban.
So what is it exactly? Edoxaban is part of a modern class of drugs called direct oral anticoagulants, or DOACs for short. And the name really tells you a lot. Oral means you just take it as a pill, and direct means it works by directly targeting a specific step in your body's clotting process to stop those dangerous events before they can happen. Now, the FDA has given Edoxaban the green light for some very specific and serious situations. First, it's used to lower the risk of stroke in people who have non-valvular AFib. That's that irregular heartbeat we talked about, but one that's not caused by a heart valve issue. And second, it's also approved to actively treat clots that have already formed, like a deep vein thrombosis or a pulmonary embolism. That's all great, but how does it actually pull it off, How can one little pill stop such a complex process deep inside your body? To understand it, just picture a long line of dominoes. This is what's called the clotting cascade. It all starts with a trigger, domino number 1. That trigger then knocks over the next domino, which activates a really key protein called factor XA. Once factor XA is activated, it knocks over the next domino, and so on, until the very end where a solid mesh is formed, and that mesh is the clot. It's a precise step-by-step chain reaction. So where does Edoxaban step in? It's what we call a factor XA inhibitor. It goes right to that crucial second step, the activation of factor X, and it just blocks it. It essentially pulls that one critical domino out of the line, and by doing that, the entire chain reaction just stops cold. The rest of the dominoes can't fall, and the dangerous clot never even gets a chance to form. It's incredibly targeted. For decades, the go-to blood thinner was a drug called warfarin. It was the standard. So, naturally, the big question for any new drug like Edoxaban is, how does it stack up against the old guard? Let's take a look. Major clinical trials were designed to answer that exact question. Now, you'll see this phrase from the research, non-inferior. In the medical world, that's actually a huge win. It's just a clinical way of saying it's just as good as. So the first thing they proved was that Edoxaban is just as effective as warfarin at its main job, stopping blood clots. And this table shows us the actual data from the huge ENGAGE-F-TIMI 48 trial. If you look at that top row for preventing strokes, the 60 milligram dose of Edoxaban did a little bit better than warfarin. But now, look at the rows below. This is where the story gets really interesting. When it comes to the risk of major bleeding, and especially the most dangerous kind of bleeding, the kind that happens in the brain, both doses of Edoxaban were significantly safer than warfarin. And this chart really drives that safety point home. When they look specifically at bleeding events that were fatal, the risk with Edoxaban was way lower. The 60 milligram dose cut the risk by nearly half compared to warfarin, and the 30 milligram dose cut it even more. I mean, that's a massive safety advantage. Okay, so we know it's effective, and it has a pretty impressive safety profile. But taking any anticoagulant is a serious commitment. It comes with its own set of responsibilities. Let's call them the rules of engagement. Here's the fundamental trade-off, the central bargain of any blood thinner. Its entire job is to stop your blood from clotting. That's fantastic when you're trying to prevent a stroke. But it also means that if you get a cut or have an injury, you're going to bleed more easily. You have to understand and respect this balance. And because of that risk, you have to be vigilant. You have to know the warning signs of a serious bleed. Things like a nosebleed that just won't stop, a severe or sudden headache, or seeing blood where it shouldn't be, like in your urine or your stool. These are not things to wait and see about. They're your cue to call your doctor right away. You also have to be really careful about what else you're taking. Even common over-the-counter pain relievers like ibuprofen or naproxen can increase your bleeding risk. The same goes for other prescription meds and even some herbal supplements you might think are harmless, like garlic or ginger. That's why it is absolutely critical to talk to your doctor or pharmacist about every single thing you take. Okay, I need to pause here because we have to talk about the single most serious warning for this drug. It's what the FDA calls a black box warning. Here it is. If you are taking Edoxaban and you get spinal or epidural anesthesia, say for surgery or childbirth, there is a risk of forming a blood clot around the spinal cord. This is incredibly dangerous and can lead to permanent paralysis. Any doctor performing one of these procedures must know that you are on this medication. No exceptions. And here's the other side of that safety coin. Just as you have to be careful while taking it, you have to be extremely careful about stopping it. Never, ever stop taking Edoxaban suddenly on your own. If you do, that protective shield against clots is gone, and your risk of having a stroke can shoot right back up. Any decision to stop has to be made with your doctor. So, after all of this, the science, the clinical trials, the critical warnings, what does it all really boil down to? When you're the one taking this medication, what is your most important job? Let's recap what we've learned. First, Edoxaban works. It's effective at preventing strokes and treating clots. Second, it offers a real safety advantage over warfarin, especially when it comes to life-threatening bleeding. But the biggest takeaway is this: your own awareness is everything. It's on you to know the signs of bleeding, to know what to avoid, and to keep an open line of communication with your healthcare team. That, right there, is the foundation of your safety.
Which brings us to one final thought. With a powerful medication like this, you've got a whole team looking out for you. Doctors, nurses, pharmacists. But when it really comes down to it, day in and day out, who is the single most important member of your safety team? The person who's there 24/7? The answer is you. Thanks for joining us.